Hello. So I thought I would go for a walk while I discuss something that I have been talking about for the last 2 months. There are such things as medical conditions that are neurological, that are developmental, that are word or things you're born with. That is the main point. All neurological developmental disorders are something you were born with. There are different neurological developmental disorders. Some disorders are more disabling than others. And of course, what is disabling is not defined by us, but by the body. So when you are born with something and it is very disabling, and it's a developmental disorder, your body tends to balance it with likeness. So if you have a condition of something missing, you're going to have an add-in. And then we're talking about neurological developmental disorders. So this is something you're born with. So if you're missing something neurological, you're going to get something neurological, meaning you'll have an added on neurological disorder, which is non-developmental. Kind of like people with diabetes can get a pump installed and they don't have to do the whole action of every single time that they go to treat their diabetes. Like, that's not fair. So medicine has come up with that. Diabetes is not a neurological developmental disorder. That is a medical disorder. Neurological developmental disorders are something you're born with. So sometimes on the opposite side, man, they tore that whole house down. Anyways, then there's other neurological disorders. People are born with additions. A mass is technically an addition. However, if it's at the beginning of it, you're not going to have a mass. Masses are tumors, and that's cancer. You can't be born with all that already fixed and stuff. You can be born with tumors, and that's not a neurological developmental disorder. Try not to get run over. So the balance is that there's something that for most neurological developmental disorders, there's something that's a little extra in output. So like diabetes, they have to add in stuff, and that that actually makes them, it's developmental, is what I'm trying to explain. The process of which something is developmental. If you're lacking, if you have autism spectrum disorder, which is like the same as an alcohol level, which starts at 0.0 and then a number. alcohol level is not point and then a number. That is way over the legal alcohol limit. The normal alcohol limit is 0.0 and then a number. So, that is autism spectrum disorder. That creates neurological conditions as a presentation because the world spins. Now, if you don't have the literal neurological situation going on and you have a working neurological developmental disorder, your neurology is fine, you are neurodivergent. That is bipolar, dyslexia, schizophrenia, Rett syndrome, low intelligence, and Alzheimer's disease. Now, Alzheimer's disease is number one on the list because it starts with A. AL to be exact. And the thing is that Alzheimer's disease is a degenerative disorder, and it is something diagnosed in late life, showing that it is a developmental disorder, neurological developmental disorder. Once you are diagnosed with Alzheimer's disease, it is something that it'll be what ends your life. And the other disorders are diagnosed from somewhere. Each one has their own age range, but they will be diagnosed somewhere between about, I think it's like 6 years old, second grade onward. Autism spectrum disorder is something that is diagnosed later on. It is diagnosed later on because it is at the back of neurological disorders, which you will 100% have, just like you will 100% die from Alzheimer's disease. There is no, oh, I have Alzheimer's disease, like it takes away your function. So autism spectrum disorder is not diagnosed until after the neurological disorders pop up. Because you're like, this is a problem, how do I get through this? And it's like, oh, there it is. So, then there are situations, dyslexia, and bipolar on one hand, and then you got, over here you got Rett syndrome and low intelligence. You cannot have Rett syndrome and not have low intelligence. So people get a little confused about the entire list because of that. Now the thing is you can absolutely, and it is super common, to be born with low intelligence and not have Rett syndrome. Rett syndrome is something that is physically, outwardly put in all your limbs and extremities is the right word. You will fully be able to see it. Rett syndrome is the most visual neurological developmental disorder that you can be born with. The thing is that most of these disorders, we'll say bipolar, schizophrenia, Alzheimer's disease, dyslexia, low intelligence, Rett syndrome, all those things. You're being born with them. That's a list of things. They are not something you medicate. You cannot medicate a disorder that you were born with. It is a part of you. That's who you are. You can, of course, treat and medicate things that arise to it, but medicating the disorder is like trying to kill yourself. So, like, most people, like, you know, they themselves, but like, or not weird. I mean, it like that is what that is. Like, you know, something's weird about your being, but you know, you may try to poke at it to find out like limits and also to be able to describe it to other people. But like, it's not something, you know, like if you have schizophrenia, that there any kind of medication you take for it is for injuries. And if you have schizophrenia, you're not going to have a schizophrenic episode because you have schizophrenia. So you're not going to have the same types of injuries that a person with bipolar might have, or a person with dyslexia. And sure enough, people who have bipolar and dyslexia are both prone to psychotic presentation in their mental injuries. And it is something that is treated with sports medicine. Most people who are schizophrenic have to take stents, just like, you know, other people, like other medications, like people take medications at some point in their life, do stents and stuff. But they have their own stents and stuff, but it is not something like, as you know, a person that's over the age of 50 with schizophrenia, it is abusive to you know, take medication. But, you know, this is a free country. You know, if you want to learn something and do a stint of medication and figure out, like, you know, some stuff about it, and you can pay all your bills and it's no harm to anybody else, that's completely legal. So, in fact, it is smiled upon, because that's probably fixing another aspect. Because, you know, some people can't even like take a break off work. You know, some people have problems like what is that? I used to deal with this, being a workaholic. You know, so habits, like stuff like that. Like I had a problem with you know, just wanting to work all the time. And, you know, I figured out when it comes to life and, you know, my people that I care about that are younger, that, you know, like there's work in life that you do, but also we should take time for volunteer. When you know about something, it's good to work with communities that don't have the access, free access, and healthcare should be free. So that is something that, you know, literally you shouldn't have to pay to go have a conversation with your doctor for something that you can look up online, but don't have the foundation. Not everybody, you know, needs to go spend 72 hours taking a class on something that you can read from the internet. But the thing is that a lot of people don't have, you know, they have a working life, so they don't have time and aren't able just to wait for like epiphanies to pop up in their mind to direct them to the appropriate information. So of course, if somebody knows something about something, it is a positive thing to go and, you know, insert that information into the group of people that are asking for that. So, as a person who has a neurological developmental disorder and several neurological disorders because of that, I have a lot of information. A lot of the information that I have is stuff that I have had mentors when I was a child because of my medical conditions and the rarity of it, point me in the right direction for stuff. They're like, hey, it's like, say if you don't have any hands, you're probably going to be a little bit more understanding about how, when you can talk and think clearly and stuff and you don't have any hands, you're going to be a little bit more understanding on what it's like to live without hands. So, same, so I have a neurological developmental disorder with 2 working neurological disorders, and that is a whole bunch of accessible firsthand experience that, given the right, books, I could have used in order to help the world around me when I am not making a living. So my, schools, as I went to a huge school at one point in time that knew me and my family and knew my medical conditions. It was a place, though, at one point in time was a medical school, meaning it had children within the school who had Rett syndrome, low intelligence. Low intelligence is still really common. It was a hospital school. I am in South Carolina, so the South is known for neurological developmental disorders. So our environment and education and our public works and stuff is all centered around that. The road that I lived on when I first moved here at 18 years old we used to call it Disability Lane. There was about, there's probably like 30 houses on the lane, and probably at least 10 of them had people who had wheelchairs. Everybody has passed away now. They're much older than me. That is the case with, disabilities and stuff. Often people do not get the health care and stuff that they need, or they get confused and stuff. This one lady, she was in a wheelchair, she was missing her legs, she was in her, the wheelchair always, and she was on pain medications. Well, she was very addicted to her pain medications. I, as a person who has a very specific neurological developmental disorder, and then 2 neurological disorders tacked on to that due to it for balance. I also get sensations of a limb being missing, so I understand about pain. I didn't know what that was until I was older, because I wouldn't even take Tylenol for a headache up until like my mid-20s, like an idiot. But this lady passed away because she got addicted to the pain medicines. They found out what she was doing, going to different doctors, getting the same prescriptions, and she died afterwards because she wouldn't take care of herself, because she didn't want to go through the withdrawal process and the addiction process. The reason why she didn't want to is because of what is at the base, because of her condition and stuff. It had progressed that far. Her diabetes, all the injuries that come along with, first and foremost, the ADHD that she had. So, which is a diagnosis of not having neurological disorders. Some people in some places call ADHD health anxiety. So, all those kind of things can get out of balance. She had her legs cut off. She had diabetes. She wouldn't, work with the doctors, and then she started committing crimes, getting more and more pain medicine. She got her husband, Tim. We got another different disabled Tim living over here now. But he passed away too, because I think they both probably had diabetes. That's really common. But he was older and she was wheelchair bound, so those are not neurological developmental disorders. People who have neurological developmental disorders that are born with a disorder do not have the other disorders that you can also be born with, Like a person with schizophrenia does not have dyslexia, does not have bipolar, does not have autism, does not have Rett syndrome, and does not have low intelligence. Same with each of them. Like, you know, it's not something that's talked about because it's also, because, like, there ain't really nothing to say. You know, it's just a fact of life. It is definitely 100% not something that can be medicated. The injuries is what you medicate. There's all kind of different things. I'm not going to go in and speak on things that don't concern me. But as a person with autism spectrum disorder, my injury that I had to deal with is epilepsy. Epilepsy is a form of bipolar. I am not bipolar. I have autism spectrum disorder. Or I don't have bipolar. I have autism spectrum disorder. So when I have an injury, it would come out as something that needed to be medicated with an anti-seizure medication. Sure enough, I tried to have children, started having narcolepsy symptoms first and foremost. I'd always had a little bit of weird troubles, you know, being like with sleeping, not sleeping too much, not getting enough sleep, but weirdness. The issue is that I could go to sleep at 9 every night and wake up at 6 a.m. with no alarm, like a roll through. Honestly, over a period of time, that can make somebody really aggressive. You're supposed to learn in life. You're supposed to make mistakes. And when you have a disorder that, you know, causes your life to be balanced because you're unbalanced, your neurological system is unbalanced. My neurological disorders that I am diagnosed with now hadn't fully bloomed. So, it made me really scared. You know, like, I am a person that doesn't, why don't I have to use alarms? You know, most people are like, oh, don't think about that, don't worry about that and stuff. And of course I don't talk to people like that because everybody deserves, you know, health care and to have friends. And I promise you, like, working every single day of the year and never getting a day off is something to complain about. So, I still today, like on purpose, have to take a day off, have to drink a little caffeine. You know, there's absolutely no reason for me to be drinking caffeine other than for a vacation. You know, some people do drugs and stuff like that, which in reality, I am the only person that neurologically needs some kind of extra stimulation every once in a while, because like I said, like medically, not as a person. Everybody, you know, for the sake of all kind of different things, needs vacations, because people deserve to go to school. So when I take a day off, it is to divert my attention away. It is to, you know, there's absolutely no reason why I should be super, super good at working every single day. There are no awards for paying your bills on time, all the time. So, you know, on the positive side, or on a different side of that, the point is that not only should I work, no matter if I have kids or married or anything, not only should I work and pay my bills, but I have to take time to do things that I don't get paid for. Because that is the rotation of, or the cycle, back and forth cycle, one aspect of it that is life. So, people who have schizophrenia do not take medication for it. If there is a group for something, 90% of the people in the group do not know what the group is about. That goes for all groups that I'm a part of. The majority of the people, literally about 90% of the people of the groups that I'm in that are like just some random groups, schizoaffective, schizophrenia, epilepsy, autism, all of them, 90% have absolutely no idea what the group is about or what is going on in the group. The thing is, though, is what the group is for is therapy. All those people that are in the group that don't exactly have things nailed down and probably never will, which is, doesn't matter. Everybody has their own lives and stuff and can be educated, slowly. We aren't taking, like I said, 72-hour classes and being certified in anything. But, if some problem were to arise, they have that group there, and hopefully there is somebody in there that might be able to direct them in the correct way. That is important. It's also important for people who actually do deal with it, or people that are close to them. It might pop up in a group and have a question, and because the world gaslights constantly. Like, if you have any of these conditions and stuff, like, you're not an influencer. You're we're not talking about just simple medical conditions either, but and when I say simple medical conditions, what I mean by that is something like dementia, Tourette's. Nobody is filing with their insurance company that they have dementia or that they have Tourette's. If they have dementia, they have another situation like cancer. If someone is suspected of having dementia, and most people aren't, there is a diagnosis called Alzheimer's. There is Lewy bodies dementia or something, whatever Robin Williams had when he killed himself. That is an actual diagnosis. Tourette's, you get diagnosis of injuries. So you aren't filing with the insurance company that you have those conditions. You aren't an influencer kind of thing. There is a lot of confusion about what it is, someone being like, oh, I'm bipolar, and someone being like, I was diagnosed bipolar. Usually, when someone says they were diagnosed bipolar, that means they have bipolar symptoms, and that would be the same thing as dementia. The thing is, the difference between dementia and bipolar and schizophrenia and the other things, dementia, like I said, nobody is filing with their insurance company that they have dementia. It's not cool. People want to have something and be an influencer and talk about stuff. So while there's that kind of medical condition that is like a patch you put on your head that's like a visual on the outside in of your description, people would do that with bipolar and schizophrenia and epilepsy too. It's a way to explain something to somebody that isn't really paying attention anyways, but it makes you feel better because, whatever's going on, Simply put, if you have dyslexia and you get a bipolar injury, you're probably going to be down for 10 years. So it is a very serious, all these are really serious situations. But the thing is that a lot of people do that inherently. They'll be like, I have bipolar disorder, and they get treated for bipolar, 10, 20, 30 years and do not have bipolar. And so the thing is that, and I do have Tourette's syndrome, by the way, so it is mild presenting, but it is there, and it is part of my visual. I used to be a teenager at once, and the thing was, when I was growing up and as a teenager and in my early adults, autism used to mean that you were a victim of a parent that had narcissistic personality disorder, or who is bipolar, or has a learning disorder and stuff, who has dyslexia. Not like the born with conditions, because born with conditions you don't have narcissistic personality disorder if you have any kind of neurological developmental disorder. So the problem is that those things outside. Oh yeah, so low intelligence and dyslexia are not medical disorders. So those people can and do have the problem is personality disorders. Now the thing is on that list, it's on my page, there are three situations in which the person does not have a personality disorder and never will, no matter what. Autism spectrum disorder, Rett syndrome, and low intelligence. Rett syndrome and low intelligence don't have personality disorders because they can't reason well enough in order to seek psychiatric help. And autism spectrum disorder is immune to narcolepsy and diabetes 1, because parts of those are parts of the disorder. So you are immune to having a personality disorder. The Rett syndrome, low intelligence, you have a personality disorder, but nobody cares because it's understandable. So as a person that doesn't have a personality disorder, of course, there are personality disorders all around me. The thing is about being born with a personality disorder is that, or any kind of, to be a person, there are 3 stages. One, up until about, I think schizophrenia defined childhood up until about 25. Then you got 25 till about between 45 and 65. Childhood, adulthood, geriatric. That's not medical. That is describing the difference between sociopathy and psychopathy, which everybody in the world is able to have unless you have autism spectrum disorder or low intelligence and below. So if you are over the limit, which is autism spectrum disorder, or under it, you cannot have. And that is literally like under 1% of people. Everybody, whether you have a childhood condition or are born with something, you have a part of a personality disorder. You're born with it. You are born with your own particular type of empathy, your own type of working way that you deal with stimulation, and then also communicate. So, that whole back and forth, like you experience the world around you and stuff. So if you're born with something, you're going to be prone to something else in adulthood, and what you end up with in your geriatric stages depends on what happens between those two. When you're born with something, you're born with something. That's who you are as a person. And if you're dyslexic, and on one hand, and you got another person, there we go. If you got one person that's dyslexic and one person that's bipolar, they look like 2 separate conditions when you meet the people. You can literally have a group of 10 people who are dyslexic and a group of 10 people who are bipolar, and you will absolutely be able to look at the group of people and tell which one's which. Now the thing is that on paper, their injury symptoms look really similar. But yet again, if you got 10 people who are injured who are dyslexic psychologically, and 10 people who are injured in bipolar psychologically, that's gonna all come out differently, but on paper it really looks the same. And there's only so many different types of medications. There's SSRIs, there's that are therapeutic to help that kind of stuff, SSRIs, SNRIs, and then you have several different ones. There's three different antidepressants, and there's 2 different types of antipsychotics. One that is for schizophrenia, and one that is for epilepsy. The epilepsy is also taken by the bipolar people, and so those are the medications. Pain meds are non-therapeutic. There is not a soul alive that will take a pain medication, an opiate, and it treats like part of the condition. Like more than, I think they're prescribed at the most like 2 weeks or something like that. You're at the wrong doctor if somebody, or you're on the tail end of your life if your doctor is prescribing you opiate medications for over a month. You can't live like that. So you're not going back to your you're not giving back to your community, to yourself. Is pretty much mainlining something, and that's not kosher. However, everybody, can have their own life, can do their own things, that is what it is. Nobody wants somebody to be screaming in pain, or an asshole, or a physical abuser. If you have reflexes to punch people because you're in so much pain, and it's proven, then yeah, you're probably going to be able to get you a script of pain medicine and stay high, on your days off, or for the rest of your existence and stuff. Those are all different lines of logic. I do think that it is really interesting how the neuropsychiatric conditions that you can be born with are all based off of each other. It is as if you've got a group of people who are all standing in a circle holding hands. Parts of autism spectrum disorder 100% will like schizophrenia. The thing is that a person who has schizophrenia, and it's 100% proven, and it's something you're born with, doesn't show those symptoms unless they are injured. So a person who has autism spectrum disorder goes through that process naturally as they're using it like it's a coping, like it's a way, the body is feeling, experiencing things, and then as your personality, balances back out with it, like learning to talk, so kids with autism spectrum disorder, when they're learning to speak, you can hear it in their voice. It sounds really eerie. It is something that if you are prone to dementia or dementia type disorders, you will probably want to shoot a child, in the Wild West or down in the old southern countries 200 years ago. You would shoot it, like crazy people, they're like, put it down, there's something wrong with it, it's broken. Sure enough, if you have autism spectrum disorder, you are broken. Not as a personality, nobody's a broken personality, but it is a situation where at one point you will have the manifestations of neurological disorders. I mean, they're there. Like, that is what you see coming out, you know, as a child who looks schizophrenic, but obviously isn't, because if you're schizophrenic, you don't look schizophrenic as a child. If you're schizophrenic as a little child, you look like you have ADD, is what it is. So, if you're an asshole as a little kid, and there's something, and you don't have Rett syndrome, you don't have low intelligence, that is bipolar and dyslexia, learning disorders and psychotic disorders, like you're doing it yourself, that's injury. Or those kids can go over the line without it being like a literal psychotic injury as a kid. Usually that kind of stuff and injury happens when you're caught off guard. So, asshole little kids will not be medicated and treated because they're children. So you don't give them diagnosis, even if they are born that way. The only disorders that you're born with that are diagnosed as a child, because the person is just literally is not doing. And the radio station is calling me. So if Cerium, XSX Cerium or whatever, but the conditions of the children that are medicated as little kids is issues pertaining to learning disorders and bipolar, and you would not give a child who is learning and growing and developing a suppressant, which is an antipsychotic. That is something that is given as an adult. So if your kid's has bipolar and has an injury, or is on the dyslexia spectrum, because dyslexia definitely is a spectrum. Some people who have dyslexia and some people who are on the spectrum. Not the situation with autism, even though that's the thing where people are like, oh, I'm autistic or I'm on the spectrum. Nobody is on the autism spectrum. Like, that's a whole, a whole different reality that has absolutely nothing to do with medicine. That is role playing. Anyways, so you literally can be dyslexic or on the spectrum as a diagnosis and just have specific learning disorders. Specific learning disorders are not something you're born with. Dyslexia is. But, you're also not going to diagnose a child with Alzheimer's, and that is something you're born with, but something that doesn't happen until you die. So, you give kids speed. That is how you medicate and treat childhood different disorders. Now, the thing is that when you're a childhood, you haven't lived long enough to have an injury like a person. What happens is, as an adult, people who have dyslexia and learning disorders and bipolar, as an adult, they can do a round of anybody, actually, even me, as autism spectrum disorder. I can't really speak for Alzheimer's because I am not completely unsure. One person I knew, it doesn't seem to be something in any sense that really needs to be medicated. It seems like something that can be medicated when they have energies, Alzheimer's is, over the counter versus going to the doctor. Like, I can't get an antipsychotic or an antidepressant, or, nobody can, over the counter. So that's something to go to the doctor for. So, when you get an injury, because you've been alive a long time and you have more to work with as an adult, and you have a psych injury, children can go free ball into the wind and take that antidepressant, but as an adult, you need to hit it from the back and use an antipsychotic. It is not something that you should stay on for very long. Something that happens that we know is that women, when they give birth, they go through a period, not only them, but if they have a partner, you know, that is right next to them, like a husband or a wife that's literally helped, you know, them have the child, whether it's adopting or literally have the child. Either way, the person next to them will also go through the 3-year period. The person, if you give birth, even if you don't complete the pregnancy and don't actually give birth, and say you had a miscarriage or something happening, just because that hormonal reaction was sparked in your body, is 3 years. There's 3 years of cognitive suppression. And a lot of people, right after they are done with their pregnancy, or in any shape or form, they are viable for a stint of antipsychotics. Usually they don't take them over a year, and to be honest with you, nobody should really be taking an antipsychotic over 3 years, ever. Like, that's not a thing. If somebody had a psychotic injury, in whether it's mild, as in you just had a baby, or either you work really hard and a lot in all kind of different forms, and you know, you had an accident, if you went the next week after you noticed that you had an injury, it just sprung up, and went into a psych ward and medicated, you still would never take over 3 years. Like, you are poisoning yourself after that. You do have an inner child in there, and so we don't give antipsychotics to children for behavioral issues unless it's really, really severe and they really need help moving stuff around. But it is really heavily watched, and this is outside of epilepsy. You know, this is, like I said, for behavioral issues. Like, you don't, like, that is not common practice to do to children unless it's absolutely necessary. Speed, Adderall, Ritalin, stuff like that, antidepressants, those kind of things are okay for children, and it's still not a big common thing that children are prescribed antidepressants. They are more prescribed speed and stimulants than they are antidepressants, because an antidepressant is just like antipsychotic. So, like I said, there's got to be some kind of physical reason behind it in order to give it to a child. As an adult, you can, obviously, but I promise you, if you take it over 3 years, you'll have somebody really, really, really not happy with you. Some people need to, now the thing is that some situations, what is needed is to do the 3-year stint or whatever, less 1 to 3 years, and then stop, and then come back, you know, to baseline, and then do it again. Some people went through that much trauma as a child. Some people really do need and can utilize that, and that's the thing, is that doctors are willing to work with patients and listen to them and talk to them and work with them on what kind of prescription meds they need, for solely because some people literally, you know, like I was told by a therapist one time that I used to talk to, and they're like, protocol is that, you know, like OCD is not a diagnosable medical condition if it's something that you use to make money. You know, because some people can and do push through and develop behaviors as habits that, and go around and they're like, oh, I have OCD, you know, and people are like, oh, get treated, and they're like, so I should get treated because I make $100,000 a year. and you want to take my job away. Like, that makes no sense. So people are silly, though, but they, you know, they want to say, like, oh, you know, actually I have OCD and it's something. But like I said, that is the difference from coming, like, where you're coming from. Like, some people, like, there's a whole list of things that you have access to on my page that you can be born with. So this person with OCD, and as an example, I have a type of OCD. It is not something that I am that candidate. I actually use OCD. I think it's bipolar. I think bipolar is the other condition that can use OCD, and it's not a diagnosis for them. Same, like, it's a process of developing habits in a way that I get into things, and it has to do with having a non-severe presenting form, like, of Tourette's, because they know why I have the Tourette's, and so the Tourette's kind of splits off into difference, where my tic and my jaw is constant, but it's working. It helps me keep attention, and people who are diagnosed with Tourette's syndrome, it's a habit. It's unlike, it's not something that, it is just who they are. Like, my OCD is like that. It's a behavioral thing. It's not a behavioral disorder. It's a behavioral habit. So I have OCD behavioral habit because I have a mild presenting form of Tourette's. Now the thing is I actually do have legit Tourette's syndrome. If my cognition goes down, where lots of people say, oh, well, I have Tourette's and stuff because, you know, it is like outside in. My body has Tourette's, my neurological system. It's not, I have OCD habits. That would be the sticker. So if I am in a car wreck and I get injured, I don't know how long that's not happened to me, but while healing from that, my Tourette's would be worse, because I am not okay mentally. So my functional neurological disorder, Tourette's is a neurological disorder, I actually literally have Tourette's, neurological developmental Tourette's disorder, rather than habitual Tourette's, which is popular. That does not mean one or the other is any better or less or anything like that. You know, it's like there isn't any way you can judge on stuff like that. It's just what it is. So now my functional neurological disorder, if I am in a wreck, it medicates it. So does my female cycle. When I have my period, my symptoms of the functional neurological disorder go one way, and my other neurological disorders, the PBA and Tourette's, go the other. So, like, some situations make it kind of like pedals on a bicycle, but they work together because I have a neurological developmental disorder. Alrighty, well, I'm going to stop this because that was really super annoying to say all of that. Obviously, I find, you know, medical disorders and stuff pretty interesting, so it's no skin off my teeth to talk about it, but and to spew some of those lines of visual logic out. But I'm also in a place where I'm just getting back on my feet, being able to put that information into a visual, into a speaking form. It's one thing of providing somebody a definition, is another thing to a skill set in order to transfer that information to someone. And I think somebody has stuck it out with me the entire time I've done this video, and I do appreciate it. It helped me get through the video and make all the points I wanted to make, even though they probably weren't very clear, but and also come to an end point with it, which is cool. So here we are. I would like to get the clarity broken down and stuff for it, and also in order to be able to regurgitate and making it a working information again. When I was younger and over the years, I just answered questions. A lot of times I'd answer questions and I'd give like the first sentence. Let's say there's 3 sentences that make up an answer. I'd give the first and the last and wouldn't give the middle, or I'd give the last 2, or I'd just give the first 2 and not give the ending. So that's how my mind works, and that's part of autism spectrum disorder. And not only does it make you make funny faces at me, but it makes me feel bad. So I'm trying to get my working skill back into place, and also back on to developing that skill where I was when I felt I could do that. And it's been almost 10 years. I at age 30 had a pregnancy and had to take a break and go a whole different route with my life for a while. And in 2026, this year, Easter, I can say, and in the following weeks, coming off the very last medication that was the treatment, can say all that is over. Because the side effect for pregnancy with autism spectrum disorder is actual legit epilepsy without a diagnosis. And as I explained to someone yesterday, they were talking about adults and any and every situation in which a person was verbal and is not verbal anymore. I'm like, that is your brain frying. And if the doctor tells you, if your brain's frying, a doctor's not going to tell you you don't have epilepsy, because you know you don't have a disorder. It's an injury. And if you have a disorder, your brain's not frying. So they can literally, at any point, talk to you and tell you whatever at the hospital, because that is how the line works. That's how faith works in practice. So today is Monday. It is the 10th. It is the 10th of May, Monday, 2026. We're going to put the year in today. And I am taking some time to walk around a little bit. I hope everybody has a really good day and enjoys their week.